There are many supplements recommended for PCOS, and today we are going to talk about one of the most popular, Berberine. What is so special about this yellow bitter powder that competes with well-known metformin? Let's find out. Welcome to Holistic Ovaries. I am Agnese, and every week I post a new video about Polycystic Ovary Syndrome. So, if you want to take control of your symptoms and learn how to take care of your hormonal health, subscribe to this channel. In this video, we are going to discover what is Berberine, what are benefits of Berberine for PCOS, what dose and form of Berberine is optimal for hormonal health, and how to increase Berberine absorption. Berberine is a natural compound found in some plants like golden seal, barberry, and tree turmeric. It has been used for centuries in traditional Chinese medicine to treat a variety of conditions, and in recent years got the attention for its potential health benefits such as reducing cholesterol, reducing blood sugar levels, and for fighting bacteria. But did you know that Berberine can also help you to regulate hormones involved in Polycystic Ovary Syndrome, including insulin and androgens? While Berberine is not easily absorbed by the body, the research suggests that it takes part in many different pathways, which are promising for treating Polycystic Ovary Syndrome. So let's dive and see what are the benefits of Berberine for PCOS. Berberine has been shown to improve insulin sensitivity and reduce insulin resistance, which is the key factor of development of PCOS. Berberine has been shown to improve menstrual regularity in women with PCOS, which improves fertility and reduces the long-term risk of endometrial cancer. Berberine has anti-inflammatory properties, which may reduce inflammation in women with PCOS, which is associated with insulin resistance and other health problems. Berberine has been shown to reduce cholesterol and triglyceride levels, which are often elevated in women with PCOS, so it can reduce the risk of cardiovascular disease. High levels of androgen is a hallmark of Polycystic Ovary Syndrome, which involves in acne, hair loss, and hirsutism. And Berberine has been shown to reduce androgen levels, which improve those symptoms. Berberine may aid in weight loss by inhibiting adipogenesis. It can also improve lipid metabolism and reduce inflammation, which contributes to weight gain. Berberine may also improve fertility by regulating ovulation and improving quality of the egg. Some studies have shown that Berberine can increase frequency of ovulation and improve fertility rates in women with PCOS. So, as you can see, Berberine appearing promising treatment option for Polycystic Ovary Syndrome. There are several forms of Berberine available on the market, including berberine hydrochloride, berberine sulfate, and berberine complexed with phosphatidylcholine. There is no one-size-fits-all answer, and the best form of berberine for Polycystic Ovary Syndrome may depend on your individual needs. However, some research suggests that berberine hydrochloride, which is the most concentrated form of berberine, may be more effective in improving insulin sensitivity and other metabolic parameters in patients with PCOS. Berberine may also be found in the form of Berberis aristata extract, which is often used in clinical trials to investigate the effects of berberine in PCOS. On the other hand, berberine complex with phosphatidylcholine has been shown to have higher bioavailability and better absorption by the body compared with other forms of berberine. This is because phosphatidylcholine acts as a carrier that helps to transport berberine through intestinal barrier into the bloodstream. It seems like there is no agreement on optimal dose of berberine for women with polycystic ovary syndrome, as different studies use different dosage and different formulations. Some studies have administered berberine hydrochloride of dose 500 milligrams 3 times a day. Other studies use twice a day tablet in the dose of 588 milligrams of Berberine aristata extract, and other study just administered berberine of the dose 1,500 milligrams a day. So as you can see in the recommended dosage of berberine in clinical trials for women with polycystic ovary syndrome is around 1,500 milligrams divided into 3 or 2 doses a day. It is essential to start at the lower dose and gradually increase it during the next few days to avoid the side effects such as gastrointestinal upset. Berberine has low bioavailability, meaning that it's not easily absorbed by the body. This is because berberine is poorly soluble in the water and is rapidly metabolized by the liver and excreted from the body. There are several ways that can increase absorption of berberine. Berberine is more easily absorbed when taken with the meals that include fat. It's because berberine is fat soluble, so it is going to be easily absorbed when taken with dietary fat. Black pepper extract contains the compound called piperine that has been shown to improve absorption of nutrients and compounds, including berberine. Look for berberine supplements that contain high quality of the compound that is more easily absorbed by the body. Taking smaller doses few times a day also improves the absorption and effectiveness of berberine. When taking berberine, it's also important to avoid certain medications and nutrients that can interact with berberine. Berberine can interact with antibiotics that are metabolized in the liver, such as erythromycin and clarithromycin. Berberine can increase the effects of blood thinner and increasing the risk of bleeding. Berberine can also interact with antihistamines, increasing the risk of drowsiness and other side effects. Berberine can also interact with the medication that help with the blood pressures, making the blood pressures go lower. Grapefruit juice may increase the absorption of berberine and lead to overdose. Alcohol that can lead to increased absorption of berberine and leading to overdose. Overdosing on berberine can lead to several side effects, including gastrointestinal distress such as nausea, vomiting, and diarrhea. Additionally, high dose of berberine can cause hypoglycemia. That is a condition where the blood sugar levels are very low. I always say more doesn't mean better. And this is always visible with my PCOS clients who are taking too much supplements, over exercising, over dieting, over restrictive, overdoing, overthinking, overstressing. Sometimes doing less, but with the strategy that is created to your unique needs for PCOS can bring you better results. You can now work with me to create personalized strategy for your PCOS. If you want to know more, click in the link in the box description. Okay, let me know if you are already taking berberine or it's the first time you heard about this. You can leave me in the comment. And of course, support our PCOS community by subscribing into the channel. And I will see you in the next video. Bye bye.